Hello, good morning. So good to see you here, Daniel. Am I supposed to say Dr. Daniel?
No, Daniel's fine.
Okay. Well, anyway, welcome to BumpWise to our coffee morning. We're giving moms and dads some time to join us this morning, but we can just get started because I know a lot of our clients are at work and busy with their babies, and they will be watching the recording later. So we'll be screening all of that on YouTube later, and I'll share the link with you as well. And I'm super excited. Like, this is the first time we're talking about this special modality that you have. Like, we've had chiropractors. I think people are very familiar with that modality by now as well. Although there are always some questions on what is a chiro, what is a physio, what is an osteo, what is the actual difference between them. But I'm excited that you have an additional modality that is really so gentle and so helpful for tiny babies, for moms who are pregnant or recovering postpartum. So I'm really excited to learn today, this morning. Um, why don't we start just by introducing yourself as well, and then we'll go into your slideshow.
Sure. Thanks for having me. Yeah, my name's Daniel. I am a chiropractor, but also an applied kinesiologist. I am from Australia, as you can probably tell. Have been in Singapore on and off for about 6 years, and have been practicing for getting on to 16 years now. So I see everybody, not just pregnancy and babies and kids, but I do see everyone. But my point of difference is the applied kinesiology. It's slightly different to kinesiology. It was developed by a chiropractor in America in the 60s. I'm certified in it, and I'm the only Australian chiropractor in Singapore that does applied kinesiology. So that's sort of my point of difference.
So does that mean that kinesiology is an extension of chiropractic, or is it something a modality completely on its own?
It's typically most chiropractors use it, but it's not exclusive to chiropractic. So there are osteopaths, physiotherapists, even dentists and GPs, not so much, well, not here, but more in Europe that use it as well. So yeah, it's not exclusive to chiropractic.
Amazing. Great. I think we'll go straight into your presentation because you've brought us a lot of information. We'll delve into what kinesiology is, what it can treat, and all of that, and some case studies as well that you have seen over the years.
Sure.
See if that will work. Perfect.
All right, we got it there.
Great. Thank you.
Perfect. Okay, so I'll get straight into it. Firstly, I'll just talk a little bit about applied kinesiology and what it is. So as you can see there, applied kinesiology is a unique healthcare system because it recognizes that appropriate body mechanics, biochemistry, and emotional health are fundamental to optimal health. Basically, what that means is we look at what's called the triad of health. So your structure, your chemistry, and your emotions, and how these all impact the body and work together. How does applied kinesiology work? Your nervous system monitors and coordinates all of your body interactions. So on that basis, the AK, as we call it, practitioner, uses muscle testing to assess your nervous system function and find a solution to your health concerns. So people would know about kinesiology and probably about how kinesiologists use muscle testing. So that's what we do. We're using the muscle test to basically access the nervous system and assess how the nervous system's functioning, as I mentioned, from a physical, chemical, and emotional perspective. What
Mm-hmm.
this allows me to do is just go deeper and find out what the cause of your problem is. And as with anything, once we know the cause, then we can go about fixing it and treating it, and hopefully getting the results much quicker and much better results than we could otherwise get. Okay, so one sec. So what does an applied kinesiologist do? As I mentioned, AK practitioners are holistic primary healthcare professionals, highly skilled in the assessment and application of structural correction, nutrition, craniosacral therapy, which some people may have heard of, meridian therapy, which is part of TCM, visceral or organ therapy, immune system function, and retained neonatal reflexes, which we're going to get into a little bit as well. So obviously as chiropractors, we focus strongly on the structural side of things, but in terms of the applied kinesiology, that's where we go a lot deeper. We look at diet and nutrition. The craniosacral therapy is vitally important when it comes to babies and children. And then meridian and organ therapy is where we can go a little bit deeper and look at more of that biochemistry, look at the emotions, the immune system, boosting immune function. Hormonal function is another one we'll talk about, as well as gut health.
Amazing. I love how holistic this is. I think it's so easy to just have the one modality and to not look at everything else that is going on in this body. We're so complex as human beings, I think. So it's really great that you have all these different modalities that you can draw on.
Yeah, correct. And with applied kinesiology, there are 5 main factors. So we look at the nerve, we look at the neurolymphatic. So your lymphatic system is your waste drainage system. The neurovascular, so nerve and blood supply. We look at the what's called your cerebrospinal fluid, which is the fluid that flows around the brain and spinal cord, which is part of the craniosacral therapy. And also we look at the acupuncture meridian points. So we're looking at a number of different aspects and how they can affect your health, and basically with the aim of optimizing function so that you either can be as healthy as possible or recover from whatever particular condition or illness you're suffering from. One of the things with my practice and using applied kinesiology is I see a lot of patients that are not pain-based patients. So I have a lot of patients referred to me for different gut issues or hormonal problems. I have a lot of kids referred to me for learning and behavioral issues and these types of things, just because it goes a lot deeper. Obviously, we do all the structural work as well, but there's a whole nother side of it that I can help with as well.
Amazing. And we'll talk a little bit more about that in a minute too. Great.
So we've just briefly touched on this, but what are some of the common conditions that I see? I mentioned musculoskeletal. In terms of, say, pregnancy related, we're looking at neck pain, back pain, hip issues, sciatica, those types of things. Digestive issues. I have a lot of patients come to me for various reasons, but it might be chronic constipation, diarrhea, bloating, gas, these types of things. Immune problems. I've found in the last few years, people tend to be getting a lot sicker more regularly and also taking a lot longer to get over things. So looking at how can we boost immune function? Obviously, kids pick up lots of things day to day. So how can we boost their immune function so that when they're getting things, which they should, how they can recover quickly, and also how everyone else can recover quickly? Because as you know, it can take
It's like hardfire. It does, yeah.
Hormonal imbalances. I sometimes if females are struggling to conceive, it can be because of some hormonal imbalances. Sometimes we'll work there. There may be different conditions like endometriosis or polycystic ovary syndrome. Often there's a lot of nutritional deficiencies, whether it's B6, magnesium, zinc, these types of things that can impact hormones. Diet, we talked about diet, but some of the more typical things I see is gluten, dairy, sugar. These things have a really big impact on our health. They're highly inflammatory, and we'll get into that in a little bit as well. So I can assess different food allergens. Sometimes I have patients bring in shopping bags of different foods to see me, and we'll go through and we'll test all the different things to find out what's upsetting their body. And then obviously trying to remove those irritants or supplementing to help the body heal. Nutritional deficiencies, I mentioned B6, magnesium, zinc, some of the other B vitamins. There's lots of different things that our bodies can be deficient in. Some of that comes from our environment, some of it comes from our diet, some of it comes from the toxins in our environment these days, and so they suck some of the nutrients out of our body. So sometimes people need help, not all, but some people do need a bit of help in this area. And then obviously stress-related conditions is a huge one these days. Now, stress isn't just emotional stress as most people would see it. Stress is also physical stress. So if you're doing a lot of training or chemical stress. So if you're eating or drinking the wrong things, or toxins, they cause stress on the body as well. So I have a look at the different pathways, like the adrenal glands, which is your stress gland. They release your cortisol, your stress hormone. We'll look at things like your HPA axis, your hypothalamus pituitary axis, adrenal axis, and how this causes the release of cortisol, which has a really long half-life as well. So it takes a long time to break down. So how can we sort of shut this system down a little bit? One thing I might mention as well in terms of stress now is we have two main sides of our nervous system, the sympathetic and the parasympathetic, if people have heard of that. So the sympathetic drives blood pressure, heart rate, respiration rate, and sends blood to the limbs, which is your fight or flight. The other side is the parasympathetic, which is your rest and digest. So blood comes back to the center of the body. Your body will digest, it will heal, and also it will reproduce. Now, in terms of females and conception, a lot of people are too sympathetic dominant. And if you go too far, your body won't be able to conceive. So we look at how we can pull the body back into a more parasympathetic state. Which the chiropractic adjustments can do, but obviously the applied kinesiology and stuff. And one of the cool things that we see in practice, especially with kids, is when I'm adjusting and treating kids, I often see them yawning before they're getting off the table because we've calmed the nervous systems down, or babies will be sleeping before they get in the cab home. So
amazing.
yeah, it's quite cute to see.
Amazing. And so this is really interesting for me as a doula as well, because in birth, it is very important too that we have a sympathetic and parasympathetic nervous system that are working well and in harmony. Because if you're too much in your sympathetic state, that is your, as you say, your fight and flight, and then the oxytocin can't flow, and then labor stalls and all of that. So I think getting your nervous system addressed, lots of people ignore that a little bit, and lots of people also say, oh, I'm not stressed. But I mean, pregnancy itself is a stressful event, I think. And then and sleep deprivation afterwards, even more so, right?
Yeah, exactly. And I mean, pregnancy is arguably the hardest thing any female could ever go through on many aspects.
Absolutely.
So
Amazing.
those are some of the more common things that I see in practice. Obviously, there's a lot more to it, but yeah, that's some of the more common things I see.
Great, amazing. And to the nutritional deficiencies as well. This is also something lots of people ignore. They're saying, oh, I eat a healthy diet, healthy, being very subjective, I think. But also it is the fact that pregnancy, you're building a body, you're building a human being, and that takes the mom carrying the baby always takes the back seat. The baby is like a parasite, grabbing everything that it needs to take. And then afterwards as well, I see a lot of moms who are hugely depleted in the postpartum period, because everything focuses on the baby, and the moms often don't take care of themselves as they should. So it's definitely a good idea to have that addressed.
Yeah, no, exactly right, 100%. All right. Now we've talked a little bit about pregnancy. So before, during, and after pregnancy, some of the more common things, obviously, I see during pregnancy is neck and back pain, or hip pain, sciatica, these types of more structural musculoskeletal issues. Another thing that we can help with is to reduce pelvic instability. Now, as you get later into the pregnancy, your relaxin hormone kicks in, which makes the joints a little bit more unstable. So we can help to just stabilize and balance the pelvis, especially through the uterine ligaments, the hip flexor muscles, and things like that. Postural imbalances, as you get a little bit bigger through the belly, you get an increased curve through the lower back, and the pelvis tends to tip forward, so that can create some lower back and hip issues. Another thing as well, as you start to breastfeed, often there's a lot of pain, or females can get more pain through their middle back. And so just adjusting through the spine can really help with that. This one here, promoting an easier labor and delivery. The pelvis forms the birth canal. So if there's any rotation through there, the birth canal will actually narrow, which will then reduce the chance of a baby moving through naturally. So balancing your pelvis and opening up the birth canal can help increase the chances of a natural birth and also reduce labor times. And there's the research to back that up. Minimizing aberrant uterine tension, fetal constraint, and possible malposition. I do have a number of patients come to me with breech babies. Now, we can't always turn them, and it depends on often the time that they come and see me. So someone comes to see me at 32 weeks, there's a much higher chance of turning it rather than 38 weeks because we've got a lot more time to get through what we need to get through.
And most
yeah, correct.
as well, yeah.
Yeah. So, and sometimes the reasons, there's different reasons why a baby might be breached. Sometimes it might be as simple as dysfunction through the pelvis and sacrum, and balancing that out will allow the baby just to turn naturally. And other times there can be more anatomical issues that we can't really help with. So it depends on a number of factors there. But there's something that I definitely see in practice and have been able to help with in the past. I haven't put it here as well, but sometimes gestational diabetes as well. Looking at not only diet, because diet's important, but also looking at some of the organs and glands associated with that, like the pancreas and insulin production, and just making sure those parts of the bodies are functioning as well as possible.
Mm-hmm. Daniel,
Yeah.
if you don't mind, can I get back to breech? Because I think there's a common misconception that a chiropractor would be turning, like physically, mechanically turning the baby, and this is not what you do. Can you explain a little bit more how you work with breech patients?
Yeah, so definitely don't mechanically turn babies. So as I mentioned, it depends on the causes, but one of the things that we'll do primarily is looking at the pelvic and sacral alignment and balancing that out to make sure everything's nice and even, opening up that birth canal. And then also working on the uterine ligaments and hip flexors and those types of things. So sometimes when they're really tight through the pelvis, through the ligaments, then it can constrict the baby's position. And so once we relax and release all of that, then the baby can naturally go into the position that it should be in. So that's primarily how we work with breech. The other thing is I will prescribe a number of different exercises as well, things to rock the pelvis, those figure 8 exercises, because we want to improve that pelvic motion and agility.
Absolutely. And then I'll add something from my experience as a doula. I've supported so many births here in Singapore, and no two births are the same. And it is so interesting. And you think, why is that? It's because we're all individual. It's the passenger and the passage that are supremely important, and they need to work really well together. So, for example, when I see lots of people say, oh, the baby is in the right position, meaning it's head down, but that's only part of the equation, right? It can be on the right side more, on the left side more. And we see that there is a difference in length of labor and ease of labor as well. So especially when I see a mom who's having a very long prodromal, a very long early labor, where she has, hours, if not days of contraction activity, but it's not really going anywhere. That's where I really like to send to a chiropractor to bring some balance in. And then often she gets a little bit of rest. The labor stops and she thinks, oh my God, what have I done? But it's actually, that's what the body needs. You need to get into that parasympathetic state. And then labor can kick off and you have a baby within a few hours,
Yeah.
So that is, I wish we could bring chiropractors into the labor room.
That would definitely be beneficial.
Amazing. But sometimes I just, in early labor, they're still at home. So I'll send them to your practice instead.
Yes, and I saw one, I think you said a little while back, who was about 40 weeks and still nowhere near delivery. But I think she delivered naturally at 42 and was fine.
Yeah, amazing. Yeah, exactly. That's the other thing, we need to normalize going over the due date, because actually 75% of women will. So, yeah. Okay, sorry for rambling on, but I think that's
great.
That even in labor, chiropractic and bringing that balance in can make a huge, huge difference. And that is not just the muscles, but it's also the nervous system, I think, that needs to be addressed here.
Yeah, correct. And we talked about that sympathetic parasympathetic balance and things like that as well. And you mentioned about how that can impact hormone function and things like that. So yeah, all very, very important and all works together as one. Now, obviously, when I'm treating patients during their pregnancy, I continue on post-pregnancy, and it's just natural that patients will bring their little babies in to see me as well for checkups. So what are some of the things I can do with kids? We'll talk typically babies first. So reflux and colic. With babies particularly, it's very, very gentle, just releasing tension through the spine, through the neck and the sacrum typically, or the cranials as well. Now, the cranial system works similar to breathing, where it expands and contracts. Sometimes one or more of the bones of the skull can get out of rhythm or sync with the rest, and then that can start to create issues. This typically, I find, happens primarily from C-section births or intervention. I very, very rarely find a baby without cranial issues post these births. It happens from natural births too, but these tend to be more prevalent. Something like reflux, for example, the temporal bone here, you have the bone, and then you've got your vagus nerve, which is the most important nerve below your neck, comes down all the way to the stomach to tell the stomach to produce acid. So if there's an issue up here, the messages don't get down, which can then start to cause reflux and things like that. Also working on the digestive reflexes, the diaphragm, things like that. Plagiocephaly, which is the flathead syndrome. Sometimes, again, various reasons, but again, C-section intervention is more common. If a baby is favoring one side or not turning, so for example, if they're not turning to the left, just more to the right, then when they're sleeping, they'll tend to be sleeping that side, which then can cause the flattening through the back of the skull there. And no doubt everyone's seen that with kids at different times. So correcting any neck dysfunction, jaw and cranial dysfunction can help get their necks turning fully, which can then help to relieve or reduce the flathead syndrome.
What is your thought on, Daniel? I have to bring this up because this is something we see so much here in Singapore, is people having a little pillow in the crib to prevent the flat head. And I know a lot of other practitioners like osteopaths who are not really a fan of these contraptions. What is your thinking on that?
Look, again, I'm about the cause, like what's causing the problem. So if a baby like us, if we all avoid pain, but as adults, we can say my neck's sore here. A baby won't tell us that. They'll just avoid. So if it's, and this is a very common issue and a common cause of flathead syndrome, if they're simply not turning their neck because they're sore going one way, well, that's the cause. So let's fix that. They'll turn both ways, then they'll lie both sides, and we don't need to worry about a pillow. So it's about, I mean, there's different severities as well. Like we can have mild, moderate, severe. It also depends on the stage or the age that a baby comes to see me. If I see a 2-week-old, I'm going to have a much bigger impact than if I see a 6-month-old in terms of head. So there's lots of reasons why, and for me, it's about, okay, let's have a look at the cause, correct the cause, and then the rest should take care of itself.
Okay. Specifically about the pillow is, I think the thinking is it keeps the baby's head in one place, but then there are voices saying, well, you shouldn't, because then they're not moving naturally and cannot develop those neck muscles correctly.
Yeah, and I think it's vital that we allow their bodies to develop naturally. That's super important. Yeah.
Yeah. Amazing.
Ear infections is a really common one we see, not just in little ones, but obviously kids as they get a little bit older. Again, the cranial bones form the ear canal. So if there's dysfunction there, it can cause recurrent ear infections. There's also research to show that chiropractic care can help reduce the incidence of ear infections in kids.
And
yep.
Sorry, I'm always interrupting, but I'm so interested in this. So, because I think that is the number one concern for many, many patients, the recurrent otitis media. And is it because the cranium, adjusting the cranium actually will allow the eustachian tube to drain sufficiently, where bacteria could get trapped and things like that? Is it that you're trying to achieve?
That can be part of it, yes. So like I mentioned with the pelvis before, if there's a rotation, it'll reduce the birth canal. Same through the skull, okay? If there's dysfunction, it's going to impact the way the canals work, and drainage as well, yes. And on top of that, not just looking at the ears, but looking at the immune system, because if the immune system's suppressed, then they're more susceptible to ear infections, versus if their immune system's strong, they're less likely to get them in the first place.
Okay. Amazing. I'll let you finish because I have another question.
Keep going. So difficulty latching and feeding. This is another common one. We've talked about neck dysfunction. If they're not turning, that's going to impact the ability to latch. Sometimes, again, the skull, the cranial bones can impact that, or jaw. That can also cause issues with latching and feeding. Obviously, things like tongue ties need to be assessed for and corrected if present. So there can be a number of different factors that we need to look at in that area. Constipation, diarrhea. Again, there's lots of different reasons, but this one I'll have a typically, especially with breastfeeding, look at mum and her diet a little bit more, and what she might be eating that might be impacting the baby. So I can test certain things on the baby, but often it's coming through mum. Gluten and dairy are two of the more common irritants I see. Caffeine is another one that will keep them up at times. Sometimes it can be formulas as well. Sometimes we might need to look at changing formulas and things like that. Or as they start to get into solid foods, making sure that the correct foods are being introduced at the right times, not going too complex with foods too early, and keeping things really simple, so as their bodies and guts are developing. So some of the corrections are really gentle gut reflex corrections, but they do make a world of difference. And occasionally babies haven't even made it out of the practice before they start going to the toilet. So I disturbed sleep patterns. This is obviously a big one for everyone. But we talked about the sympathetic parasympathetic nervous system, but just calming the system down, releasing some of the dural tension through the spine and skull can help their bodies just sleep. Sometimes I'll have babies come in and they're really, really upset and really irritated, and they're in even almost a fetal position because there's just so much tension through their body. And, within a few sessions, generally, we can help just to release some of that tension, which calms them down, which then allows them to sleep a bit better, which then obviously allows mum and dad and everyone else to sleep more as well. The retained neonatal reflexes, we'd probably get into this a little bit later, but we have primitive reflexes that we developed in utero that are like survival reflexes, and within the first 12 to 18 months of life, they integrate back into higher brain centers, and we develop our postural reflexes that we have for the rest of our life. Sometimes these reflexes don't integrate properly and they remain dominant, and that's when they cause issues with concentration, motor patterns, behavior, hormones, vision, speech, all types of different things. So I'll go through and assess and correct them at various stages, but typically these are the kids with learning behavior issues, ADHD, dyslexia, neurodivergence, these types of things. And again, C-section at this stage does appear to be the most common cause. Obviously, we need to allow these reflexes to integrate naturally, but it's important to keep an eye on them. And if they're not, potentially correct them so that they don't cause the issues later on down the track. I was having a chat with a patient the other day who I saw through her pregnancy, and I have seen her baby since she's 2 weeks old, and she's about 4 or 5 months now. And we were just talking about how well her little one has been doing all the way through so far, and how well mum did through a pregnancy and post-pregnancy, just because, they've been coming in and getting treated regularly and just keeping on top of these things. We can't say we can cure autism or this or that or the other, but we can definitely help improve the function of the body, which hopefully can prevent some of these issues from arising later on in life, because it's far easier to prevent rather than cure.
Absolutely. And I think we see a lot of that cropping up all over the place. And you say too, you see it in your practice a lot that so many more kids are diagnosed or not diagnosed, but show the all the different symptoms that you can have on this vast spectrum that is, ADHD and neurodiversity, I guess, in general. So I think it's a good idea to keep for someone to keep an eye on the baby. I mean, we're not professionals as moms, right? It's good to have someone who knows where my baby should be at this stage, and are they there, and how can we help them to get there as well, and also for babies not to skip things too. But Daniel, I know that you have so much more, but you keep saying on this slide C-section. So
Yes.
I'd like to come back to that because obviously we're not shaming anyone. C-section save lives and all of that. But what is it in a C-section? Lots of moms think, oh, well, my baby isn't being squeezed through the birth canal. So shouldn't that be better for them, because they're coming out unsqueezed kind of thing. But what is it? How does a C-section impact a baby as opposed to a vaginal birth?
So that squeezing, as you mentioned, is vital. So the birth canal is smaller than a baby's head by design. And as the baby passes through the birth canal, it compresses the skull and initiates the craniosacral mechanism, so the pumping mechanism. So that is a vital component of that last part of birth. Obviously, if you go through a C-section, that doesn't happen. Now, also with C-sections, it is a major procedure, and sometimes they could be emergency C-sections too, where the baby needs to come out as quickly as possible.
Yeah.
So when the baby is being pulled out, they don't necessarily worry about how they're getting them out. They just need to get them out. So they might be pulling them out from their head, from their shoulder, from their arm, which can create a lot of structural issues that they don't necessarily get when they go through the birth canal. Or if we're looking at forceps, you're obviously elongating the skull, ventouse, those types of things as well. And so that's where you get these cranial, as we call cranial faults or cranial issues from. Now, just because a baby's born by a C-section or because they have intervention doesn't mean they're going to have a cranial fault for the rest of their life. Definitely not. And doesn't even mean that they're going to actually have one because of the birth. But it's always really, really important to check them to make sure and correct anything as it shows up, because these things are relatively easy and straightforward to correct early on. But later on in childhood and life and things like that, obviously it's much, much harder. And when they're starting to create the issues and things like that. So like I said, it's super important to get baby checked. Even a natural, uncomplicated birth, so to speak. I mean, the baby's going through a canal that's smaller than them. They're getting rotated. It's a very traumatic experience for a baby to go through as well, physically, chemically, emotionally. So that's why it's a great idea just to assess. Sorry?
Traumatic, necessary, traumatic, but useful.
Yes. Yes.
Right. I think we often say traumatic and it's all, but it's something that should happen. It's something that nature designed as well.
And that's exactly right. Nature designed it this way for a reason. So, but it's really important to get them just checked to make sure everything's working as well as it should be. Occasionally, I have babies that I see that I really don't need to do much on at all because they do really well.
Yeah. And so for all the moms who've just given birth, whether vaginal birth or C-section, when is the best time to see you after birth?
As soon as possible. So it depends on how comfortable the mother is, coming in and when that happens. Obviously, sometimes you might be in hospital for a few days post-birth by the time you get home and feel comfortable leaving. But generally speaking, most of my patients that I see during their pregnancy will be back within about 2 to 3 weeks of birth. So I see babies from birth. Typically, between the 3 to 6 week mark is when they start to become a little bit more irritated. So they're generally pretty calm for those first couple of weeks, and then they start to have the issues, and often people bring them in for an issue. So that's when I generally see them at that stage. But ideally, the sooner the better, yeah.
Okay, great. Amazing. You don't do home visits, do you?
No.
Okay. Just asking because I know these first 2 weeks they're so important for the mom to actually heal, right? So getting into a taxi and getting to Dempsey is not always feasible, and they're still finding their feet with feeding and with sleep and so on. But yeah, you heard it, mummies. Sooner rather than later. So maybe as soon as you're confident enough to leave the house, your bleeding has sort of subsided a little bit. Maybe that's a good time to see Dr. Daniel as well.
And everyone's a bit different, and everyone's birth is different and things like that. So recovery timelines are different, and some people have more help than others, and there's so many factors involved, as everyone would know.
Yeah. Amazing. I learned a lot here.
I'm glad. I'm glad.
Yeah.
Now, so just moving on, this one, I just thought I'd talk about as well. I tend to specialize more in gut health and nutrition. So with chronic illnesses, most illnesses due to inflammation, and a lot of this comes from food and toxins in our environment. So I mentioned gluten, dairy, and sugar. Most of my patients would hear about the gluten and dairy spiel at some point in time. Both highly inflammatory, both cross the blood-brain barrier. Gluten gets stuck in all of your tissues, and dairy typically causes a lot of inflammation in the small lining in the gut. Sugar obviously affects your stress and hormonal pathways. These foods and toxins and different things obviously cause changes to the gut microbiome, and then this can tend to lend itself to like bacterial, viral, fungal, parasitic infections. So you might be able to see, oh no, I've got my screen. I've got lots of different supplements, different herbals. I have different test kits. So I'll check a lot of different infections in the gut and then work out what someone needs to correct that. Now, obviously, we're very mindful during pregnancy and also breastfeeding not to supplement where we can't. But sometimes diet alone will make a big difference. I mentioned gluten, dairy, caffeine, even sugar with babies who are being breastfed as well. And that can often have an effect on them. A lot of little ones have skin conditions, and the skin conditions reside in or stem from the gut. And often this is not always, but oftentimes it's due to foods, and dairy for me in practice is the most common one I see.
Yeah. And I think the gut is so important. I think lots of people don't realize that's your immune system as well. That's your immune system right here. And we have more bacteria than we have human cells in the body. And we need to give them some tender loving care, because it's actually good for us. And so this is where in pregnancy, I urge a lot of people, look into eating fermented foods and things like that and really get some help, because a lot of the issues that a mom can run into in pregnancy, candida overgrowth, like all these things, as well as GBS, where moms who are on the call who are maybe or looking at this later, if you don't know, you're being tested in week 36, and if you have an overcolonization of group B strep bacteria, you will be subject to antibiotics in labor, which then further exacerbates the problem as well. It does a good thing too. It protects your baby. I'm not saying we shouldn't be doing it, but the thing is, if we can create that balance in the gut beforehand, it will also balance out our vaginal microbiome too. So I think it's a really good idea to have that addressed. So I can't, I love that you're doing this actually, because not many practitioners are this aware of the gut and the microbiome.
And you mentioned about the vaginal microbiome. That's super, super important. And we see that particularly if that's out of balance, how it can create gut issues and issues in babies post-birth.
Exactly. And C-section babies, we come back to that because they're not exposed.
That's another reason, you mentioned like the differences, and there's another difference as well. So, and as I've got here, our gut is our second brain. You mentioned about the immune system. 70 to 80% of our immune cells are produced in our gut. 80 to 90% of serotonin, which is one of your main neurotransmitters, is produced in the gut. So it really is our second brain. You mentioned about the microbiome. We work in a symbiotic relationship, not just in our bodies, but with the environment. one thing, as kids get older, it's super important that they do run outside and play in the dirt, and get exposed to these different things, because a lot of our genome is composed of viruses. So we work as one, and I think sometimes in our modern world that gets a little bit lost, that we are still part of nature.
Yes, absolutely.
All right. Now I just thought I'd go through just a few reviews that I've had from patients, and just to give you an idea of some of the results that people look at. One of my patients, I started seeing her baby and then saw her and her other child as well. But she mentioned she was having her baby was having constipation, was slow to crawl. She also had a lot of muscle weakness, like she was just was struggling to sit up on her own and different things, had a lot of skin issues and eczema and things like that when I first saw her. After the first session on the same day, she did a big poo and started crawling straight away. I mentioned that before. So she's decided to start sessions for herself and her toddler. She was breastfeeding at the time, so she was getting a lot of upper back pain as well, just from breastfeeding. She mentioned after a few sessions, they used to get sick regularly, but they hadn't been sick in 2 months. So that's what we're talking about before with boosting immune function. They used to get a cough or a flu every 1 to 2 weeks before that. And she said her back tension has improved a lot, and her baby's been doing soft, regular poos as well. So sometimes I do see kids that when they first come and see me, they haven't had a bowel motion for a week or 10 days, and they're told that it's normal, and it's not normal. So I think that's really important, that we get them, going to the toilet regularly, as often as they should be. So that was one of my patients. Another one brought her baby in to see me as well for, again, digestive issues. It's a really common thing I see. The baby's getting quite sore and gassy through her tummy. After a few sessions, the gassiness really improved and she was much happier. Now, as you know, with little ones, like there's lots of reasons why they're going to be unsettled or upset. And one of those reasons is just simply being uncomfortable or in pain. So that's something we can definitely help with. She was, she mentioned that her daughter didn't necessarily always like being around strangers and new people, but she felt quite comfortable. So one of the things is we try and have a bit of fun in here as well, because the more comfortable kids are, the easier it is to treat them.
Amazing. And I think that's what I loved reading most when you said, this can address reflux and colic, because I think a lot of our moms struggle with that. And it's often so difficult to get to the bottom. And the only answer the I don't want to slag anyone off, but the only answer they're getting is BioGaia. Always, that is the only tool that they have in their toolbox. And we can do so much better by these babies. And this will make everybody, happier. We have a WhatsApp group that is dedicated to NICU mamas. And a lot of these mamas are have very premature babies, and all of them have reflux issues. So knowing that there's that there's help in that regard is really good to know, and I'm definitely going to share that in that group as well, the recording of this. Can I ask you a question quickly? Sure. Because Sabrina, Mommy in our group was asking that. How long does it take a baby on average to turn both sides, and when should we be concerned about a baby only turning one side?
Yeah, I think we were having this chat a little bit earlier. Everyone develops at a different stage. So for me, it's more about allowing them to develop naturally and not forcing the development. Sometimes babies will start to roll over will start rolling after a few months and things like that. They might tend to go one side to begin with, but eventually they should start to go both sides. There's certain things you can do to assist with that. Such as stimulating them on the side that they're not going to get over on that side. So even when I'm treating babies, if I'm needing to work on, say, their neck and turning their neck one way, I'll get the parent on the opposite side. So when I turn their neck, the baby will still be looking at mum So it's just that little bit of distraction and stimulation and comfort. So if they're not going one way, you can get on that side and get some toys and just play. I do this, tummy time is one of the most important things you can do early on. Kids that don't like tummy time is a real indication of a cranial issue as well, by the way. Yeah, that I find that very, very commonly. So sometimes you'll see this as well on tummy time where they'll only be favoring one side. So again, it's, are they not rolling over because of a structural issue, for example, or is it just they're starting to roll and we need to give them a little bit more time to figure out you've got to go both ways? So I don't sort of run necessarily. I know there's timelines, but these are also guidelines. So we need to just be mindful of allowing kids to do things in their own time, whether that's rolling over, whether that's starting to crawl, even starting solids. I mean, there's certain timelines that are optimal, but sometimes kids might be a little bit earlier or might be a little bit later, and that's okay too. Allowing them to crawl and things like this. So with crawling, it's a little bit easier, I guess, for parents to maybe see that there may be a structural issue. So for example, if they're dragging one leg, there might be an issue through the sacrum or the pelvis that we can address. Rolling, it's a little bit harder to see that. But if a baby's with the neck, because that's where you see it turning one way more so than the other, then I would suggest there may be an issue there through the neck that we need to address. Because again, it's about they haven't developed their peripheral vision. That doesn't sort of happen to about 12 months. So if they're favoring one side, that's all they're going to see, and they're not sort of going to go the other way as much, just generally with their whole body.
Yeah, and that's an interesting thing now, because I was just thinking of with breastfeeding, we always alternate sides, right? With bottle feeding, for example, we don't.
I say that to all of my patients, you've got to even bottle feed, just change sides, because that stimulation gets their heads and necks turning both ways, which is super important for the pathways at the back of the brain and for peripheral vision.
Totally. Amazing. One question in the chat pertaining to that, I think, is it still useful to test for retained reflexes at 4 years old? Or is that too late? Has the train left the station?
No, it's definitely not too late. I sometimes even see them in adults and work on them in adults. No, so 4, 5, that sort of age bracket is actually when I will start to see the kids with the learning and behavioral issues because of this, because you don't generally see that, in the first couple of years of life. It's when they start to get into school and interact with kids and stuff that you tend to see some of the issues. So no, definitely not too late. It's never too late. I have, with the retained reflexes, typically the ones that I see are primary school age kids, because they come to me because of a problem, and typically the problem is they're falling behind at school, or there might be some social anxiety or things like this, or some of these other conditions, ADHD, neurodivergence, starting to get diagnosed. And so that's when I would typically see them. So obviously the sooner the better, but 4 is certainly not too old, and there's certainly a lot we can do at that point in time. Sometimes as well, they might have, say, issues that may look like it could be the retained reflexes, and it's actually not. There could be other things at play. Gut health might be one of it, or might be other structural work. So for example, with kids that have hyperactivity, typically they're low in vitamin B6 and low in manganese. So we need to supplement there. So there can be some nutritional deficiencies around that as well. But yeah, no, 4 is certainly not too old. It's never too old.
And here it is, a keyword for me, nutritional deficiencies, because obviously we have tiny little babies and even toddlers or 4-year-olds. The last thing I want to do is draw blood. Yeah. And isn't that where kinesiology comes in? Because you can test in a way that is very gentle and doesn't need a syringe and all of that.
Well, and the other thing is, so when we're talking about, say, a blood test, we're looking at a clinical result. So there's basically a level that you shouldn't fall below. And if you fall below, then you've got low whatever or high whatever. But that's clinical. So with applied kinesiology, we're looking at subclinical. So the next level sort of between health and clinical. So it falls in that bracket of not disease, so to speak. So I sometimes will have patients where I'll pick up like that their bodies need zinc or magnesium, but they've had a blood test and the blood test says, no, they're fine at that level, but their bodies are saying, no, we're not. The other thing is with the zinc, magnesium, for example, there's a lot of different forms of it. So which form are we looking at in a blood test? Because if we're only looking at one form, we're missing the other dozen.
Yeah. Wow, very interesting. Love that. Okay, do you still have a case study? I love these because I think it makes it so clear for moms what are the actual things that I could see Dr. Daniel for.
I think this one was more like adults because I've had a few kids, so I thought I'd put this one in. But patient of mine had ongoing gut issues for many years, and she works with a lot of mums as well in the work that she does here in Singapore. And so she decided to come in and see me. She was getting very, very bloated all the time, and she was waking up at 4 or 5 in the morning, having to go to the toilet, and then couldn't get back to sleep. So her sleep was really suffering from it. But after a few treatments, we worked on some of I believe she had gluten and dairy issues. So I got her off both of those. And in her line of work, she was going around telling all of her clients about it. And so then I had an influx of patients from her telling her clients about getting off these foods. And also supplementing and treating some gut infections. And she came back and she used to lift her top up and say, look, my tummy's flat, you know, like, which she used to get bloated very easily. And, you know, once we get sort of those really good results, then we can go even a bit deeper and look at, okay, like specifically, like I have one of my patients who about 5 years was having gut issues as well. And, you know, take a history at the start, which is very important. And worked out that he'd been to Bali just prior. And so there was some parasitic infections there. So I got him to do some fasting. We treated the infections and stuff. And he dropped about 9 kilos in weight from that. And he used to not be able to go and eat out because if he ate out anywhere, it'd affect him for about 3 or 4 days afterwards. But following this, he could eat out, and not that I have encouraged him to do so, but he's like, I've had pizza now and it doesn't affect me. So he's able to eat like foods that really upset him prior. But now what we're doing is we're getting even more specific. So like with gluten, what we found with him is the more processed it is, the more it's affecting him. So he can go and have like sourdough bread and stuff and he's okay. But if he has anything with like, say, cornstarch, it's no good. And so he brings different grains in and we test them and work out exactly what his body can tolerate.
This is so interesting because I talk about that all the time. And I think there's even a Netflix thing that is on gluten and how when you process grains the traditional way where you leave it to ferment for like 72 hours, it's a whole different story than what we find in gardenia bread on the shelves. You know what I mean? And a lot of people may not. I mean, celiac is obviously a completely different story, but a lot of us think we're gluten intolerant, but maybe we just need properly done food. You know what I mean?
Well, yeah. And so you mentioned intolerance. So sensitivity and intolerance is different. So celiac are intolerant, they can't have any, whereas most people are sensitive. I had a patient, this was a couple of years ago, but she was getting cluster headaches. For those that don't know what a cluster headache is, it drives people to suicide. They're that bad. And I got her off gluten and her cluster headaches disappeared. And even the neurologist agreed that it was gluten. And so they wanted to go and do a scope and see if she was celiac. And so prior to that, you need to be on gluten for about 4 or 6 weeks. And all the headaches came back again when she started the gluten. So that was a really sort of extreme case. But you're right as well. So in Australia in the 60s, I believe it was, for harvesting purposes, wheat was genetically modified and they doubled the chromosome number from 14 to 28. The human body can't tolerate a 28 chromosome wheat, which is why no one should be eating it because so gluten typically causes autoimmune issues. So the body starts to attack itself. So, I mean, I can go into it in a lot more detail in how it all works, but many people have heard of leaky gut. And so typically gluten and dairy, they pull the tight junctions apart and cause this leaky gut. So allow larger molecules into the bloodstream, infections, things like that. Leaky gut is like IBS or sciatica. It's a really broad term. It doesn't tell you what's going on. It's more of a symptom. So then we'll go through and find out, okay, what is it? Is it gluten? Is it dairy? Or is it not diet? Is it, you've got a parasite that's affected your gut? So yeah, we can go into that.
I hope it's that and not the gluten, because I love my sourdough bread and my pizza and so on. So there might be a different cause. Anyway, that I wanted to tell you that because I teach a solids workshop for moms where we talk about introduction of foods and which we should start with and so on. And I talk about the fact that babies have a naturally leaky gut and what to do to support the development and maturation of that gut so that they're able to, so that we can support them in the way that is beneficial for them. And we talk about fermented foods there as well, and to introduce them from the start and things like that, because it's so important to help them with that maturation. So
that's a really important point. And I think a lot of people forget that. And I talk about when parents are introducing solids, to just remember that the gut is developing, and solids are meant to be brought in ideally at a certain time, because that's where the body's at that point in time. And so keeping it really simple and then gradually introducing more and more complex foods as the gut develops more and more and can handle it.
Yeah, we're absolutely on the same page there. And I'm really passionate about this because introducing solids is so much more than finding the right spoon for feeding your baby, There's one coming up, by the way, in September and October. Anyway.
Apple fish together.
Oh, sorry, someone.
That's strange.
No, it's nice.
Sorry, muting. I think that was done on accident. Okay. Moving on quickly because we only have 4 minutes left, but
well, this is my last slide anyway. So just my approach is a bit different because of the applied kinesiology. So looking at the cause of your problem, and once we know the cause, then we can hopefully correct it. And looking at the body as a whole, very holistically, and also very naturally. So I do working with a number of different practitioners, midwives, doulas, lactation consultants, PTs that work in the space, GPs, a whole range of different practitioners. My passion is really natural healthcare. So that's obviously what we're trying to achieve through treatment, through supplementation, through diet, these types of things.
Love that. Thank you. I've learned so much. Mummies, daddies, parents on the call, grandparents, maybe even. If you have a few questions still, let us know now. Oh, yes. Can you do chiropractic adjustment on pregnant women for lower back pain?
Yes, definitely.
I think we can stop sharing for now. Yes, I think you can benefit from that a lot. I mean, there's so much going on in the hips. So much, everything is changing. Like Daniel was saying earlier, and you might not have been on the call yet, but the relaxin hormone is making, producing lots of changes in your body as well. The added weight of your baby. So I think there's a lot that can be done with chiropractic, just balancing you out. I would really encourage to try that. Anybody else have more questions? No. Anyway, Daniel, it was amazing. I loved how our presentation flowed. You had so much interesting information. And I can really encourage all parents to go and see you. I mean, you're obviously very approachable. As you said, you're really gentle and fun with the babies as well, which is so important to find a good practitioner for that. And it is such a gentle modality, kinesiology is. So really try Dr. Daniel out. He's in Dempsey. I don't know if you would be happy to share your slide as well later and put it under the YouTube video. Maybe I can do that. I need to find it out technically if that's possible, but I'll try my best. So thank you for spending the morning with us. It was really enlightening. We learned a lot, and I think all our mummies are very happy. on the call, and we'll share your details later, and I'll send you the YouTube link as well, so you can share it with your clients as well if you wanted. And yeah, I had fun this morning. I hope you did.
So did I. Thank you very much for having me, and my number's there. So if anyone has any questions, they're more than welcome to reach out to me on WhatsApp, and we can I can answer any questions I have too.
Amazing. Sounds great. Thank you so much. And thank you all for all the parents for joining as well.
Thank
See you.
you.
Bye-bye.